Okay, let's talk about now about the pelvic girdle. And remember, what is a girdle? It's a belt. There is encircling a part of your body. We described the pectoral girdle previously as not as a true girdle, but as a belt that is open on the back. Remember, both scapula didn't fused or don't fused on the midline. Let's compare that pectoral girdle with the pelvic one. And the pelvic girdle consists of two hip bones that are this. We call them hip bones or coxal bones or pelvic bones as well. And they're fused in this anteriorly in the midline, right in here, and posteriorly they join the sacrum. Remember the sacrum part of the actual skeleton. So as you can see, this is a true girdle. There is closed in anteriorly and posteriorly. Um, the shape of the pelvis is different depending if we're talking about a female or a male. Usually, females' pelvis are wider because they're adapted for child bearing. So they're wider, they're a little bit in both diameters. Um, what are the functions of the pelvis or the pelvic girdle? Well, the most important function is that on either side, as you can see in here, we can see these sockets, and is where the head of the femurs, which are the bones of your thigh, articulates at. So it attaches both lower limbs to the pelvic girdle and attaches the pelvic girdle to the actual skeleton. Down in here, remember, inside this is the pelvic cavity, part of the abdominal pelvic cavity. In there are contained organs of the reproductive and urinary system, part of digestive system organs as well. So the pelvic girdle protects or creates a bony shield for these organs. And when we compare these pelvic girdles with the pectoral girdle, of course, since this one is a closed girdle, it has less range of motion than the pectoral one. The pectoral, the scapula uh, were not joined or are not joined in the midline, and that gives a lot of mobility to this girdle, unlike the pelvic one. So this one is more stable, okay, but we have less range of motion, totally different with the pectoral girdle. Now let's describe these bones, the hip bones that are forming the pelvic girdle. So these are the pelvic bones, coxal bones, hip bones. And when we were ugly fetuses, again, this bone consisted of three different bones that after birth they or during childhood they fused together into a single bone, which is the coxal bone. So the three bones that are forming this bone are, and excuse me about that, are here in beige. The superior portion is the ilium. In green, this is facing posteriorly. That's the ischium, posteriorly. And anteriorly, you can see in red the pubis or the pubic bone. Now, this is the lateral view of the coxal bone. And I know it because there is this socket that is called the acetabulum, which is the socket that receives the head of the femur to form the hip joint. So of course, this is facing laterally. Look in this diagram in here. See, I can see here the femur, which is the bone of your thigh. That's the head and attaches or fits right into the acetabulum, located laterally on the coxal bone. Now, on the ilium, when you place your hands over your hip, that you touch that bone, that arch, uh, um, or bony arch, that corresponds to the iliac crest, which is the most superior part of the coxal bone and of the ilium. What else are we going to describe in here? Okay, we cannot see it in here, but because this is a lateral view, but medially at this level, posteriorly, the ilium has a surface that allows it to articulate in this area with the sacral bone to form the iliosacral articulation or sacroiliac articulation. What else? The ischium is this green part or posterior aspect of the bone, and you can see this wider and roughened elevation here in the bone. This is called the ischial tuberosity, is where you're sitting on right now. Well, if you're seated. Um, and anteriorly, we can see the pubic bone, which is more thinner or flat. And both pubic bones, articulate on the midline anteriorly. See, this is one pubic bone and this is the other pubic bone, and they articulate anteriorly to form the pubic symphysis, which is a type of articulation. So we just place a piece of fibrocartilage right in there, unite the two pubic bones, and there you go, you have the pubic symphysis in there. So these are the general aspects about the pelvic girdle. Again, um, the specifics about each bones are going to be studied on the lab. See you in the next video.